Tonight on this all-new edition of Healthcare Update, we are going to take a privileged glimpse of a top chiropractic neurologist, Dr. George Kukurin, and his pioneering methods of neural rehabilitation, designed to ease pain and restore lost function to patients suffering from serious neurologic conditions. Welcome to Healthcare Update. I'm your host Laurie de la Hosse. Stay tuned as we travel to the West Valley of Phoenix, Arizona. Our remarkable story starts right now. Tonight, joining us via satellite we have yoga superstars, Sanela Osmanovic and Adriene Mishler. Are you with us, Sanela?
Hello my friends, and welcome to Psyche Truth. Sanela here.
And also joining us from her yoga studio is Adriene Mishler. Hello Adriene, can you hear us? Let us know we're connected.
Hi everyone, welcome to Yoga with Adriene. I'm Adriene and this is Benji.
Then from his office in Avondale, Arizona, the chiropractic neurologist Dr. George Kukurin. Dr. Kukurin, are you with us?
Hi Laurie, Dr. Kukurin here. Greetings from sunny Avondale, Arizona. It's great to be with you.
Dr. Kukurin, you're going to share with us a technique called nerve flossing, and how this technique may benefit patients suffering from painful peripheral neuropathy. Before you get started, why don't you tell our audience exactly what neuropathy is? Then describe the nerve flossing technique, and finally, tell our viewers with neuropathy how they can use yoga as a form of self-nerve flossing.
Well Laurie, neuropathy is one of the most common conditions to affect the peripheral nervous system. Neuropathy literally means sick nerves. One of the most common causes of neuropathy is diabetes. However, there are numerous reasons why a person may develop neuropathy. The feet are most commonly affected. But as the condition evolves, the hands, and virtually every nerve in the body may malfunction. The patient usually suffers from pain, and/or numbness. And unfortunately there are not very many good medical treatments currently available to provide relief for the symptoms of this condition. When we think of the word flossing, we think of flossing teeth as in the dental procedure. I want you to consider the back and forth motion of flossing, and we are going to see how we can apply this to the treatment of neuropathy. To apply flossing in the treatment of neuropathy, we must first consider the mechanics of nerve motion. When we move our foot, for example, what happens to the nerve inside the foot? Well, if it is a healthy nerve, it actually glides and moves along with the motion. Some combinations of motions apply tension on the nerve, pulling it in one direction or the other. There are a number of studies that show a nerve may lose its ability to glide, and because of this it becomes subject to mechanical tension, which can reduce its ability to function normally. In patients suffering from neuropathy, the nerve is already compromised, and this additional mechanical tension further damages the nerve. So by using reciprocal motion in the feet and toes, it is possible to create a flossing type motion of the nerve, and in many cases this will restore normal nerve gliding and relieve pathological tension, which contributes to the pain of neuropathy. We can take this one step further and apply certain yoga poses to promote the flossing of the nerve in hopes to restore normal gliding. By using yoga poses, it may be possible to obtain relief for many patients suffering from painful peripheral neuropathy in the feet. Remember how we talked about nerve flossing? Let's look at how this first yoga pose affects the tension on the nerves going to the feet. With the toes tucked under as seen in the pose on the left side, the nerves tend to migrate down or glide towards the feet. It is important to remember, if you experience increased pain or numbness while doing these poses, you should discontinue the exercise. If this occurs, these exercises are not appropriate for you. Not all neuropathy cases are the same. So you must find the individual therapy that works best for your particular situation. Now look at a complementary yoga pose on the right. This will cause the nerve to glide in the opposite direction. By alternating between pose 1 and pose 2, the nerve will glide in reciprocal directions. This has the effect of creating a flossing type action on the nerve. So if you have neuropathy, and if the gliding action of the nerve is compromised, alternating between the two yoga poses may restore normal motion to the nerve, and reduce abnormal tension, providing some relief from your neuropathy pain.
Okay, so what you're going to do is you're going to face towards the top of your mat. And just coming into a seated position, And then you're gonna take your weight forward, tuck your toes underneath you. So basically like you're coming into a demi-point, and then you wanna see how far you can rest your hips. Now this might be enough for some people, especially if you have bunions, and if your hips are too far above you, this is where having a cushion to rest your hips on might be really comfortable. And release your weight forward if you were sitting all the way back, palms right under your shoulders. Very gently let those toes go. And you're gonna just wanna roll through the ankles. We'll stretch through the toes slightly and just tap the tops of your feet on the mat ever so slightly and gently, just kind of returning the blood flow to those feet. So we have another ankle stretch here, which is a little bit different. We're stretching into the front of the feet, and I'm actually just gonna move myself a little bit more into the middle of my mat so I don't get cut off in the frame here. But what you're gonna do is you're gonna take your...
Before you attempt any home treatment for your neuropathy or any medical condition for that matter, you should consult with a licensed practitioner to see if the activity is safe in your particular situation. I can't stress enough that if this activity appears to be aggravating your neuropathy symptoms, discontinue it immediately. With that being said, you can now assume the first yoga pose, which should cause nerve gliding towards the toes. Hold this position for a 10 count. Slowly transition from the first pose to the second pose. This should cause the nerve to glide towards the knee. Hold this pose for a 10 count. Alternate between pose 1 and pose 2. Do this exercise 5 times. So this is an example of how to use yoga poses as a form of self-nerve flossing for the restoration of nerve gliding in the feet. Hello there, I'm Dr. George Kukurin. I hope you enjoyed my video. If you are like most people, you probably had no idea that there are alternatives to conventional treatments for serious neurological conditions. I'm here to tell you, you don't have to live with it, but don't take my word for it. Subscribe to my YouTube channel. You'll see examples of what is possible with the work we do. Check it out, because seeing is believing. If you're seriously interested in finding help with your neurological condition, you owe it to yourself to visit our web pages and find out more about what we have to offer. You'll be glad that you did.